Well, good afternoon, everybody. I'm Colin Peckrin, Program Director at Grantmakers in Health, and we'll be moderating today's webinar, COVID-19 Implications for Healthy Food Access and Security. The COVID-19 epidemic has put a strain on many social supports, not least of which is the food system and food safety net. Reliable access to healthy food, a challenging proposition in the best of times, has become a major issue facing more and more communities across the country. Today, we will discuss the critical challenges food systems facing right now, how the food safety net is responding, and how grant makers can help with immediate needs, the eventual recovery, and beyond. And to help us guide through this discussion, we are joined by three fantastic speakers, Gita Rampersad and Lindsay George of Feeding America, and Dara Hessee of the Colorado Health Foundation. But before I turn things over to our panel, I need to cover a few quick pieces of housekeeping. Our call is going to be an hour long. It is being recorded and will be posted on our website along with the slides and any additional resources in the next few days. All participant lines have been muted. If you happen to have any questions, please feel free to type them into the questions box on your control panel indicated here on this slide at any time. We are hoping when we get to the Q&A portion of this webinar that we'll have a chance if folks want to maybe ask questions live or perhaps query other folks on the call. You can do that and I will unmute you if you use the raise hand option in your control panel, again indicated here on the slide. But yes, please be aware that like many organizations right now, we are running these webinars out of our homes. There could be some technical difficulties. In fact, I can say one of our speakers has been having some difficulty just getting the software loaded because of firewalls. But please bear with us. And if for some reason you come across a problem you yourself can't solve, Program Assistant Monique Jackson, and her email address is right there, is on the line and will be happy to assist you. So please bear with us and we'll get through this together like pretty much everything else these days. So with that, and without further ado, I'm going to turn it over to Gita and Lindsay. All right.
Hi, all. Can everyone hear me?
Yep, loud and clear.
Wonderful. Okay. Well, hello, everyone. Good afternoon. As Colin was saying, we are having some technical difficulties on Gita's end on her computer. Our IT department was trying to get her access to the webinar and had to reboot her system. And so just one of the many joys of remote working and having unexpected technical difficulties. So thank you for your patience, everyone. And I'm hoping that Gita jumps on to join us shortly. But in the meantime, I would love to get us started and just share a little bit about, as Colin mentioned, the strain that is happening just across the country on food supply, and really, the impact on our work in particular on just those that are food insecure throughout the country, both prior to COVID-19 and then, of course, in the midst of really this unprecedented crisis. And so looking forward to chatting through kind of an overview on that today, but then also looking forward to answering questions at the end. So just grateful to Grantmakers and Health for this opportunity to share more about our work. So thank you for that, Colin. I am going to go through, and if anyone has any issues hearing me, feel free to just let me know. So just a little bit about Feeding America broadly. So Feeding America is a nationwide network of 200 food banks and 60,000 agencies. So that is 46 million people across the country that we are serving on an annual basis. That includes 12 million children and 7 million seniors. Those pantries can look quite different across the country. Some of those are churches, local food pantries, pantries that are located in schools. There are many distribution models, and as you can imagine, right now during this time, they look, similarly in some spaces, but then also quite different as we try and innovate and also really be respectful of social distancing right now and ensuring that our food distributions are as safe as possible for not only the individuals that we are trying to serve, but then also for our staff and volunteers at the food banks. We have many of our food banks are operating on skeleton staffs and trying to do our best to ensure that we are keeping everyone as safe as possible given the current circumstances. So who does our food bank network serve? And so the 46 million people that are experiencing food insecurity. In the bubble here, apologies, I just realized I should minimize this. Hopefully that's better for folks. I don't know. I don't want to accidentally X out. So these are the populations that we focus on most specifically. And so, like I said, seniors and children are a huge portion of the population that we are serving. Also working families. We know that many families, while they're working, many of them are in a situation in which they do not qualify for safety net programs. And so many of these families rely very heavily on our food banks to help supplement their incomes and support their families. And so that is a huge portion of the population in which we are focused on and build quite a bit of additional programming outside of food distributions around. And then also rural populations, that is a huge focus for the Feeding America team nationally. Just before the crisis, we were in the process of rolling out our equitable access strategy, acknowledging that the rural populations across the country that are experiencing deep food insecurity also have very unique problems in accessing food. And so just given that many of them are living in food deserts, they may not have the capabilities to drive, far distances to travel to get to food banks. And so trying to ensure that we're building programming around reaching these individuals. And as you can imagine, during this time, that's of particular importance, especially when you think about like two of these scenarios being combined with seniors and seniors living in rural populations. And so trying to figure out in which ways, whether it be for senior mobile distributions, trying to make sure that, we are building out the appropriate interventions to reach those people. So just a little bit of background about our Feeding America Food Bank Network. So we were created as a community solution to the challenges of poverty, hunger, and food waste. And so at the beginning, one food bank was created to help support food insecure individuals in a community. And then over the years, the Feeding America National Office was established to become a membership organization for these food banks. So we, any surplus food, for surplus food distributions, this is a huge piece of what we're seeing right now across the country in terms of just the scarcity of surplus food. A huge percentage of the amount of food that moves through our food bank network is surplus retail donations. And given that that is not something that we have access to, just given the scarcity of food, we've seen a huge decline in that, which is causing a number of our food banks to instead be purchasing food piecemeal at the local level. And so this is something that we are very quickly trying to address, whether it be through national purchasing agreements nationally with our partners, and trying to just ensure that we are moving food as equitably and efficiently through the network as we can during this crisis. But just this image just kind of represents the surplus food moving through our local food banks. And then from there, those are distributed through our 60,000 agencies throughout the country and then delivered to the people that we serve. I should note that just during this time of crisis, we do have a number of our food banks who are actually distributing food directly from their food banks. Obviously, a number of our agencies are still very active, but our food banks have taken on the distributions as well, more so than in normal times. So food distribution is, of course, at the core of our model, and we know that that will always be the biggest component of our work to serve people that need us. But we also realized that just given the meal gap that still exists, despite the number of people that we are serving as a network each year, we know that the food bank model had to evolve over time, and just in response to the complex challenges of social and economic equality in the US. And so these are just a list of some of the programs that are active across our food bank network. From job training, case management situations in which we have individuals who can support people on a family by family basis, safety net resource enrollment, so we have SNAP application assistance in some of our food banks. We also have healthcare screenings, which I know Gita, my colleague, will also be speaking to just shortly. But really just a representation of really trying to view a situation as holistically as possible, acknowledging that we have such an opportunity, being able to have this touch point in our food banks to help support individuals, and ensuring that we have the resources available to do that. And this is just what we call internally our house. It is our 2025 strategy that really helps us drive towards food security. So our goal is by 2025, in collaboration with our network and our partners, we will ensure access to enough nutritious food for people struggling with hunger and make meaningful progress toward ending hunger. And so these are the pillars that are at the core of our work. Feed, of course, is ensuring increased access to nutritious food. Nourish, which is the improved diet quality aspect of our work, which Gita leads that work for the organization. Empower, improved financial security, ensuring that people facing hunger experience improvements in their own personal security, helping to understand building assets to move themselves out of poverty. And then Unite, which is increasing public passion to end hunger. As you all know, we have been at the forefront of a lot of conversations around this issue, which has really, allowed us to tell a deeper story about hunger, not only during times of crisis, but throughout the year. And so really trying to tell that story about the fact that, when the cameras go away and this isn't as much of a topic that people are concerned with, it's just acknowledging that the people who are experiencing food insecurity before this crisis are even experiencing higher food insecurity than before. And so being mindful of the long-term effects of a crisis like this. This map right here, the darkened areas, just really represents the food insecurity rates. And so just want to acknowledge that, of course, as you can imagine, the hunger looks very differently across the country. So ensuring that our programming is really deepened in these communities and a special attention to, not only where food insecurity rates are the highest, but also acknowledging that there's quite a resource disparity where we have lower resourced food banks often in these communities that are experiencing the highest food insecurity. This is just a quick note about our research. So Hunger in America, that is a study that we conducted as an organization until 2017. Hunger in America was provided an in-depth look at who is in need, how the need is currently being met and by whom. This study was a tremendous way to answer questions about the clients we were serving, agencies that were helping to serve those individuals, and the network as a whole. From that report, we were seeing that 2/3 were having to choose between food and other basic necessities. The median monthly income was $927. And through the 46 million people that we reach each year, 389 million times a year, many people were routinely turning to us for assistance. And so this was people that were frequenting the food banks throughout the year. In 2017, we decided to no longer do this study because we were doing this at a higher level, and it was showing us a very broad understanding of who we were serving. But we really realized that we needed to develop initiatives that would help us better understand really the unique needs of the people that we were serving across the network. Those 4 key initiatives that then turned to drive our strategic research agenda included understanding the journey and drivers of food insecurity, identifying promising food security solutions, demonstrating root cause intersections, and informing public policy by showing the implication of systems change and policy on food security. So really realizing that we did have an understanding of what hunger looked like in America, but given that it affects people in different ways, it was really critical to our ability to tailor solutions and drive action upon those issues to really move the needle moving forward. This is just a representation of the research interventions that we have active at Feeding America now. As you move around the circle, it moves from our local interventions, ones that complement both our local and national work, and then our national interventions. And so these run the gamut of trying to understand how many people are food insecure in a community, how is food insecurity being experienced in a local community, who and how many people are being served within our food bank service area, how is food insecurity currently being experienced within key populations and communities, and then what interventions, programs, and initiatives work for those individuals. So really trying to understand at the local level who the food bank is serving and how many people within their broader service area, and then taking that information up a notch and being able to look from a national perspective how food insecurity is being experienced across different populations and demographics. And then, of course, how many people are receiving charitable food assistance and what are their characteristics. And so really critical to be able to operate both locally and nationally to understand those different perspectives. And then I know my colleague Gita is on the line, and I'd love for her to jump in to just share a little bit more about our work around hunger and health.
Thanks, Lindsay. Hi, everybody. Sorry for the technical difficulties, but I'm glad to be here. Wanted to just start out the remainder of the slide deck by mentioning my role here at Feeding America. Essentially, my role is to continue to explore and strengthen the intersect between hunger and health. And this slide just represents the understanding that we have that a healthy diet is the foundation to good health, to financial stability, and to food security. So we put a lot of emphasis on not just providing access to food, but providing access to healthy food and also providing opportunities to change behaviors to produce better health outcomes. Next slide. And here at Feeding America, particularly in the health and nutrition section, we have a goal. We want to improve health and diet quality for the people that we serve. And we feel that an essential equation to getting there is by providing access to healthy food and also to helping people make more healthy choices, whether it's from the food that we put in our food banks to the nutrition educations that we provide to our food bank members and their partners. But we feel that this is the basic equation to improving diet quality from a food bank perspective. Next slide. But as you know, access to healthy food is not enough. There are complex factors that shape dietary patterns and also often put health and healthy eating out of reach. We are committed to addressing the social, the structural, the systemic factors that can be contributors to poor health outcomes. And we partner with organizations that also have equity top of mind. Next slide. I think I do want to take a minute to mention we are not a disaster relief organization, but Feeding America is a leader in times of disaster. So obviously, right now it's very important that we have a frontline presence in our communities. And this slide just represents some of the ways that we are able to provide a frontline presence and provide food, water, and supplies to people and helping them cope through these challenging situations. As Lindsay had mentioned, we have 200 food banks around the country that serve all 50 states, DC, and Puerto Rico. And these food banks work with over 60,000 food programs. So combined, they serve every country in the county. Every county in the country. We are a fleet of over 2,600 vehicles that are ready to respond. We also have over 10 million square feet of warehouse space. And maybe you don't know, I didn't know this until recently, that 86% of our food banks operate mobile pantry programs. So we deliver food to hard to reach communities. Also, we have over 2 million volunteers that are ready to help, but sometimes in times of disaster, particularly pandemics, we are finding that volunteers are not always the ones that we used to be able to count on, are not always the ones that we can in this time. So we are continuing to be creative as we are leading in times of disaster. Next. So I'm segueing into discussing a little bit more in detail about the impact that COVID-19 is having on our industry, and mainly the charitable food system, and what the data show. So one of the tools that our research department has developed is a bi-weekly survey called a pulse survey that allows us to continue to understand the increasing need across the network. And so I've added a few statistics from last week's survey to give you an idea of what we're looking at in terms of need. So almost 100% of our food banks have reported an increase in demand for food. And I guess the average increase is about 63%. Over 50% of our food banks have reported a decrease in their inventory from the same time as last year. And again, almost 100% of our food banks is reporting an increase in operating expenses. These are averaging around 31% increase. And then over 2/3 of our food banks are reporting an increased need in volunteer support and assistance. So, you know, we're looking at these numbers, and we have come up with a staggering financial figure that is sort of an estimate of what we're going to need just over the next 6 months to provide food to people facing hunger. And in order to sustain and evolve our operations, just through the next 6 months, we are estimating a $1.4 billion shortfall. This is all inclusive. We are also talking about food that's supplied through the government and resources that are supplied through the government, but it is nonetheless, it's staggering. So wanted to make sure that we kind of framed the impact of this pandemic, and even in just 6 months time, what we're anticipating. Next slide. So I guess the next question is, what are we doing about it? Well, first and foremost, we launched a COVID-19 response fund, and this is a national food and financial fundraising effort that's to help support our everybody that's facing hunger and the food banks who help them. So as you know, the increasing, rising rates of unemployment, we are seeing people coming through our doors that have never had to access food banks or food pantries before. And so this response fund is particularly useful to support this increased need. We also are building an inventory of emergency food banks. I believe we've got hundreds of thousands of emergency food boxes that we are distributing to our food banks across the country as we continue to see the increased need. Our national office is providing emergency grants to food banks to support local response efforts. So some of money that sits in our emergency preparedness fund, as well as some money that's coming in through the COVID-19 response fund, is going out to the communities, to the food banks, to support their local response efforts. And I believe that we have dispersed over 100 million in funds. You may know that or have recalled recently seeing that Jeff Bezos has given us a generous $100 million donation to help in this COVID-19 response. All of that money is going directly to our food banks in their communities, and it's already been dispersed. And finally, we are safely continuing the distribution of food. We want to make sure that we are protecting the health and the safety of everybody involved in the food bank distribution delivery process. And so we are taking additional measures to make sure that we are distributing safely and effectively. I guess this slide is really to show additional support that we are having to provide to the network food banks during COVID-19. There is a supply chain shortage. I mean, we just cannot keep up, the supply can't keep up with the demand. And of course, a lot of the hoarding activities that we're seeing across the country, from toilet paper to hand sanitizer and other products, is impacting our ability to be able to stock our own food banks and to provide the neediest with the resources that they deserve and that they're standing in line for. So we're trying to overcome these supply chain shortages. One of the ways we're doing it is by building a comprehensive food purchasing initiative. We are also, our government relations team is actively engaged in, advocating for the needs of hungry families. We have a initiative right now to make sure that we are getting the attention of lawmakers when it comes to SNAP assistance. We are looking to increase the SNAP budget by 15% during this time so that we can make sure that everybody's needs are or at least better fulfilled through SNAP. And finally, our team of experts in the national office, we are providing a range of resources to our food banks as they continue to try to meet these soaring needs. We've opened up a help desk, and our member engagement team is pretty much working around the clock to be able to provide one-to-one consults with our food bank members in order to be able to help meet their needs and answer their questions. And to dig a little bit deeper, specifically around health and nutrition during COVID-19, I mean, it's important to understand that even though this is a time of crisis, that it is extremely important not to forget about your health needs and to continue to manage your comorbidities and your existing, chronic conditions during this time, because we just don't want to have a domino effect of one need not being fulfilled, leading to so many other unmet needs that are, and then we'll just have more of a crisis on hand. I encourage you to visit our hungerandhealth.org website. We've got some interesting and creative approaches to how we are addressing health and nutrition during COVID-19, and those are all available on the Hunger and Health website. And if you're interested too, there are some wonderful stories about what our food banks are doing, as well as some of the members and the clients on feedingamerica.org. But in particular, in our health and nutrition space, we've stood up a public health task force because we've always been involved in the food access, and we've had a footprint in the health space. But right now we have to amplify the public health response. So our task force is made up of internal and external subject matter experts that are providing resources such as toolkits and emerging practices that, as well as technical assistance to help protect the health, safety, and well-being of our members and our communities. 3 examples of work groups that are housed within the task force are the Workplace Health and Safety Work Group, our Mental Health and Well-being Work Group, and our High Risk and Health Disparities Work Group. Additionally, we are working closer than ever with our healthcare partners, our payers, our health systems, associations, and academia, because we know that we cannot go at this alone, so collaboration is key. We are engaging in research. This is a time for us to learn, and so we are capturing as much data as we can, and we are going to learn from this experience. We have epidemiological white papers underway. We are tracking economic trends, and we are looking at what the impact is to children, and particularly on people who are burdened with chronic disease and are disproportionately affected by this illness. And finally, Feeding the Frontline is an example of a partnership that we were asked to join that's external to our organization. And this is between the Aspen Institute is involved in this, as well as World Health Kitchen, and it involves producing and reviewing a set of health and safety protocols for restaurants and hotels as they continue to help feed the frontline healthcare staff and system. So I'd be remiss if I didn't include a couple of stories from the network. I'm a big storyteller. I think it's an extremely effective way to really understand and connect with the work that's going on the ground floor. So recently you may have noticed in the news that the San Antonio Food Bank had 10,000 cars in line for food. We decided that we would include a couple of snippets from conversations that were captured during these times on the San Antonio Food Bank. So one woman mentions that she has a son with disabilities. He has a special diet. Certain foods upset his stomach and his overall health. It's a tragic thing when you wait in line to get in line for hours, struggle through the crowds, and then turn to the aisle you need and there's nothing. When I pulled up to this distribution and I was able to see the vegetables I was getting, it made me overwhelmingly happy. Being a single mom with 2 kids, I just need to get home and cook. Another story from the same food bank is a visitor saying that, we don't have the strength or the financial capacity to hoard. We only have money for groceries for the next 2 days. When someone asked me to open my trunk and your employees start filling it up with groceries, I started to cry. Thank you for helping us, even though you don't know us. So it captures, what is really happening in the message that we're hearing on the ground floor. So I encourage you to go to feedingamerica.org, where there are more of these stories that we share. But also, if there are other ways that you'd like to engage with Feeding America and with our member food banks, I have some suggestions. First of all, we welcome your support. We are always looking for additional resources. We are looking both at a national and a local level. Subject matter expertise is welcomed. We are looking, volunteers. There are a lot of volunteer needs at food banks right now on a local level. Additionally, I think there is a need to cultivate some connections between our member food banks, the public health system, local public health system, and healthcare. As much as food banks are working with their public health agencies, I think there's more work that could be done to help cultivate these relationships, and this is something I think that might be an opportunity here. Additionally, like I said before, we cannot do this alone. The ability to collaborate, particularly, like, for example, around helping with SNAP enrollment and other benefits enrollment, that's another need that the food banks are expressing to us that they are falling short on, is not having enough SNAP coordinators. And of course, finally, be our partner. Help us advocate for keeping the needs of our food banks and our communities front and center with local legislatures and also with our federal legislature. And I guess I'd like to leave you with 3 key messages for long-term recovery. So I'm big on health equity, and I wanted to make sure that message comes through, that equity matters, that nobody is going to be or should be forgotten during this time. And so it's important to, with all of our work, that we lead with an equity lens. I think secondly, partnerships are essential. We want to work with you. We want to, help each other. And again, we can't do it alone. And then finally, I'm always a glass half full person, even in these difficult times. So I just want to leave you with saying that I know that brighter days are ahead, and that we are going to get back to continuing, our passion and our influence around ending hunger. But we will get through this. So thank you for this opportunity to get to present to you, and I look forward to a lively question and answer period.
Great. Well, thank you so much, Gita and Lindsay. And now to present a funder's point of view and discuss the work that they're doing in response to COVID-19 and how it fits in with their larger work around food and hunger is Dara Hessee from Colorado Health.
Hi, Colin. Thank you so much. I'm just going to get my slide started. Hopefully this will work. We tested it earlier. Did that work? Can you see my screen, Colin?
Yep, you just need to put it into presentation mode now.
Oh, I did do that. So that was, it's on the wrong. Oh, yeah. I think we got to, I apologize. I think it's that same issue as before.
Well, worst case, I've got my, got your slides queued up, and we warned everybody, and
Well,
this is just the nature of running things from home.
I apologize. So you're not seeing it when oh, there we go.
Okay, we're going to get your notes here too, I think is the only thing right now. So it's swapped back.
Oh, the other one isn't open. Okay, let me do the display setting then. How about that?
There you go.
All right, woohoo. All right,
All
thanks
right.
everyone for your patience. I really appreciate it. I'm Dara Hessee. I'm a senior program officer with the Colorado Health Foundation, and it is such a privilege to be with you all today. Colin, definitely let me know at any point if I need to speak up or if there are volume issues, and if I should speed things up so we have enough time. I'm here today to share a little bit about how our organization has responded and pivoted during this pandemic. I'm very much looking forward to the discussion later so I can hear from you all about how you have responded and questions that you have. Before I get going though on our COVID response efforts, just wanted to do a little grounding in terms of our organization. We've changed a lot. We've been a foundation for quite some time, for many years, but we've changed a lot specifically over the last few years. We spent a good deal of time in 2017 and 2018 getting really clear on our purpose and who we exist to serve. And that informed the development of our organizational cornerstones. The first is that we serve Coloradans who have low income and historically have had less power and privilege. The second is everything we do is intended to create health equity. And the third is that we are informed by the community and those we exist to serve. We work within 4 focus areas, including one specifically aimed at strengthening community health. This is really our area more focused on the social determinants of health, where we partner with communities as they identify and really tackle health-related challenges. And by investing in food quality and affordable housing, we are creating a foundation for which communities can develop locally specific solutions that result in health equity. Our focus on food access and security is quite new for us. And a few years ago, we actually formally adopted food access and security as one of our priority areas. And one of our very first efforts in this space was supporting the convening of individuals and organizations from across the state working on or experiencing hunger in their own homes and communities to develop the Colorado Blueprint to End Hunger. It was released in early 2018 and is a 5-year plan to end hunger for all Coloradans. To support the implementation of this really important roadmap, a 5-year program office was stood up with our support. However, we really want the community to be in the lead with this work. And so in order to ensure the community is truly leading and sustaining this effort, our foundation is not a member of the governing council, which holds accountability and decision-making authority for the Blueprint Initiative. The program office was really not set up to compete for funding with existing nonprofits or to replace any current work. Instead, among really other things, it was established to communicate across systems and stakeholders and to serve as a point of coordination on initiatives and across efforts. So this just recently got stood up. And so when the COVID crisis started to happen, it became immediately clear that the Blueprint Office could and should play a significant role with coordinating hunger and food insecurity response efforts. Serving the community was one of the first things that the team did to service needs related to technical assistance, food distribution, volunteers, cash assistance, materials and supplies, and infrastructure. And through this survey, you can see sort of the bullets, the findings from the survey. We learned that the most significant needs were safety supplies, shelf-stable food, and transportation vehicles. Additionally, technical assistance needs included how to safely work with volunteers and how to best establish drive-through and home delivery options. The need for immediate cash assistance also came through loud and clear. To meet these needs, the Blueprint has set up regular coordination calls, a collaboration platform, and webinar trainings. They also quickly established the Colorado COVID-19 Emergency Relief Fund. This is a screenshot from that website. This was done in partnership with our foundation and other funders, and to date, the fund has raised over $2.2 million. The fund is designed to strengthen work already happening in our communities and to increase the capacity of local organizations to respond to emerging needs. Funding may be used to cover operating funds, including food, staff, packaging, safety supplies, food storage, and transportation equipment, as well as client communications and other things. So you can see it really directly aligns with the needs that were identified in the survey. And the max grant award for that fund is $25,000. The first application round took place the week of March 23rd. 385 total applications were submitted, totaling nearly $7 million in requests. So you can see that the need is far outstripping the available funding. The second round took place the week of April 6th and had a very similar response, and the third round is currently underway. This fund has truly been an effective way to meet urgent community level food access needs, with nearly 1.5 million in grants awarded to date across the state. However, as I mentioned, in terms of the need outstripping available funding, we needed to figure out other ways to have an impact and meet the needs that weren't being met through grants available through this fund. So in addition to supporting the Rapid Response Hunger Relief Fund, we have made contributions directly to the Feeding Colorado food banks, which are part of the Feeding America network. Those are the Food Bank of the Rockies, Care and Share Food Bank, Well Food Bank and Community Food Share, and Food Bank of Larimer County. And this is helping address funding gaps resulting from really unprecedented demand for their services. These 5 food banks are working diligently and have been over the last several weeks to adjust and modify their food delivery models to respond as effectively as possible to the crisis. So these are the key investments we have made so far, but we continue to monitor the crisis and new and emerging needs to assess how we can further respond to issues around hunger and food insecurity. I just moved up the chain last week, a recommendation for additional funding in this space, and so we are thinking about what future investments might be. So we all know that COVID-19 has resulted in significant hardships, particularly with respect to issues around hunger and food insecurity. However, it has also helped us better understand the issues and make some really important connections. So despite the incredible challenges created by this crisis, there are some silver linings that we've identified. So the first is that it's really increased public awareness of hunger and food insecurity issues. It's truly brought this quote unquote hidden issue into the forefront and showed that hunger is widespread with statewide impacts, and a clear demonstration, frankly, that hunger can be just an unexpected life change away for anyone. It's illuminated gaps, inefficiencies, and duplication in our food systems. It's allowed for really quick adjustments to public food assistance programs like SNAP, WIC, Summer Food Service, TFAP, the Child and Adult Care Food Programs, CACFP. The approach has been pretty tactical at first, but now partners are starting to strategize about longer term, more systemic changes and the potential to keep some of these programmatic flexibilities in place even when the crisis is behind us. It's really made transportation barriers more visible, and it's highlighted food pantry duplication and competition issues. Additionally, COVID has supported experimentation of creative and innovative solutions. And I just wanted to share some of the examples that we've seen so far in Colorado that truly give me hope. So there's been the development of new tools such as resource mapping and food matchmaking to better connect food producers with new markets. It's putting, the food banks have been putting census materials into emergency food boxes, so kind of that cross collaboration. It's resulted in a coordinated statewide response to meet the specific needs of small and mid-sized growers beginning farmers and ranchers, veteran farmers, farmers of color, and female farmers. It's resulted in the sourcing of food locally to avoid larger supply chain disruptions and providing technical assistance to help with this. And it's established creative food delivery approaches. So we've seen city bus drivers delivering food to seniors. We've seen fire departments doing home delivery. I'm sure many of you have heard, or maybe you are involved in school districts using their school buses to deliver food to families. It's resulted in some incredible new partnerships, both within and across sectors. So truly, we've seen more and more regular community conversations focused on food access. And new partnerships in this space are being established, like with regional transportation districts, public health, healthcare, economic development, restaurants, family resource centers, emergency responders, and others. And it's really provided the opportunity to reimagine our food system to have more equitable outcomes. Overall, sorry, I apologize, folks. My daughter just walked in. You're fine, thanks, sweetie. Yes. Overall, we're wanting to better understand how food resources are shared and accessed. Food banks are coming together to identify more sustainable and equitable solutions. We've seen increased community interest in and desire for more locally sourced food, and COVID has enabled communities to truly see what's possible. And this has been one of the most exciting things, to really break down existing mental models and old ways of thinking that previously hindered progress. And finally, it's highlighted the importance of statewide coordination and infrastructure, both for long-term impact and for emergency response. So we were really thinking about our statewide roadmap when we launched the blueprint, but it has been instrumental with emergency response during this time. I apologize. So that said, we do know that not every state has the same platform and backbone support to lead this important work. That being said, there really is still so much that funders can do to have impact in this area. And I've listed off a couple of things here, and we'll talk just briefly about each one. So if there is an opportunity, you can contribute to existing relief funds that are in place, and making sure that these relief funds are prioritizing hunger and food access. If possible, you could partner with other foundations to establish a hunger relief fund. We have a fund here in Colorado that the governor's office has led, in addition to the Blueprint Hunger Relief Fund, and that's been in partnership with other funders and corporate leaders. And our Denver Mile High office is serving as the fiscal sponsor and grants administrator. Community foundations also have the ability to serve in this role. We're really wanting to ensure that new flexibilities with public food assistance programs are broadly leveraged. So this is really an opportunity to ensure in your communities that the waivers that have been put in place with SNAP, WIC, CACFP, TFAP, the child nutrition programs are broadly communicated and being widely used. WIC, for example, WIC waivers are allowing for more remote enrollment for actually all, in Colorado, it's all remote enrollment now, and increased food options to address food shortage issues within grocery stores. And importantly, unlike SNAP, access to the program is not restricted based on immigration status. So one opportunity is to find trusted organizations to do outreach to families to really help them understand the WIC program and what it can do for their families, to ensure that this benefit goes as far as possible to meet the nutrition needs of immigrant families who are truly being disproportionately impacted by this crisis. We just got a great presentation from Feeding America, and I just wanted to underscore that outreaching Feeding America food banks to understand their challenges and needs is a great step as well. Colorado food banks are experiencing double and sometimes triple the demand. And as Lindsay mentioned earlier, they really need resources to purchase food since grocery store and other donations have dwindled. Further, they have needed to rapidly shift to mobile and grab and go delivery options, which has impacted their operating budgets. And I was not surprised by the $1.4 billion gap that Gita shared when she was presenting. That really syncs up with what we are seeing in Colorado as well in terms of the needs of the 5 big food banks and the food pantries that they support. And then lastly, you could convene partners and other actors in the food space to collaborate and coordinate. This could include, I mean, think creatively, really, like other funders, government agencies, advocacy organizations, grantees, as well as non-traditional partners such as transportation, public health, the healthcare system. And then lastly, and I know we don't have much time, so I'll just zip through this, but we are really continuing to think about how we can shift from emergency response to longer term impact. And we're really beginning to explore what this all means for our strategic direction. Obviously, we had the path that we are on and things have shifted quite dramatically. So we'll be continuing to engage with grantees and monitoring policies, thinking about a strategic advocacy approach, and then really overall intentionally exploring opportunities to address inequities throughout the entire food system from production to consumption, and those specifically which have been exacerbated by COVID. So it's really provided an opportunity for us to think big in this space in terms of what our future food system could look like in Colorado. So I will end it there. I know we don't have as much time as we had hoped, but Colin, I will turn it back to you.
Great. Well, thank you, Dara. That was a great presentation. You guys are doing a lot in Colorado, and we're certainly going to be curious to hear what you learned as time goes forward. So we've gotten a couple of questions through the system here. The first one I'll queue up here in a second, but first I want to launch a quick poll to everybody who's on the call. So hopefully to bring everybody back here for a second, but I'm going to go ahead and launch this here really quick. But the first question I wanted to ask everybody was, are you increasing your funding for healthy food access or food insecurity as a result of COVID-19? So hopefully if you can just press yes, no, or if you're considering it, please select that. I just want to maybe do that here really quickly. So if you can just answer that here. Okay, it looks like we've got about half of everybody on the call has voted. Give it another second here before we, and so far it's looking resoundingly like most everybody is, or at least is considering it. Going once, going twice. And all right, I am going to go ahead and close the poll here in 1 second. 2, 1, okay. So it looks like, yeah, at least about a good 74% of you are increasing, if not 17% of you are considering it. And so I just had one more question for everybody before we go into Q&A. Do you think COVID-19 will impact your long-term, let's say beyond maybe not the next 12 months, healthy food access and food insecurity strategy? Yeah, so hopefully you're looking at either this is going to be a very likely, I mean, nobody can really see the future at this point, but likely, probably, or too soon to say. All right, give it one more second here. It's looking like I'm not terribly surprised, but it looks like it's likely to be happening. And I just realized that on the poll, I cut off one of the words. One of those was supposed to be not very likely, but I'm going to say probably too soon to say are probably folks in that regard. So I'm going to go ahead and close the poll here in 1 second. All right, well, thank you so much. So it does look like, for everybody that you all are at the process of looking to increase your funding, as well as you have a feeling this is probably going to be something that's going to make you having to probably change your strategies to one degree or another. But first, let me turn now to the one question we've received so far. This is definitely directed to both Lindsay and Gita. So the questioner thanks you all for the great work that you're doing at Feeding America. But this person has heard at the community level, they're hearing some rumblings from local food pantries that they are not getting any kind of discount from regional food banks for their increased orders. And that the food banks in turn are saying that their own costs have increased as they purchase from Feeding America. This question was wondering if you could shed some light on how, if any, increased support to Feeding America trickles down to hyper-local food pantries. says, of course, this is probably a very complicated issue and just wants to get up and understand sort of how things are operating in this regard. So I will turn it over to the two of you to answer.
Sure.
Okay, thanks, Colin. Dara, you want to go first, and I can chime in a bit?
Gita, do you want me to jump in first, or do you?
Lindsay? Yeah, sure.
Okay, I was just gonna say quickly that yes, obviously at the national and local level, we are having to purchase food more so than we typically have. Some of the numbers that we've seen across the network have been double, triple, even beyond that. Food banks are spending beyond their annual spending for purchasing food, just because, like I said, of the decline in product donations. As Gita mentioned, we are working on national purchasing agreements across the board with some of our bigger partners, both nationally and regionally. Those prices that are trickling down, some of the money that is being spent at the food bank level, that is obviously having an impact down to the agency level. I can share that in the response fund that Gita talked about, we are doing our best. We have already dispersed funds and deployed funds to every single food bank in the country. We know that in a lot of cases, and of course right now we're hearing anecdotally, but in a number of cases we are hearing from our agencies that they are having their fees waived for the month, given that they are seeing such an increase in the amount of food that they're needing to purchase. And so we do know that a lot of the money that is flowing from us nationally, we are providing flexible support to our network, whereas in some cases it's oftentimes restricted. This is completely flexible support for the food banks to spend as they need. In a lot of cases, that money is being applied to support their agencies by waiving their monthly fees for food purchasing. So I hope that that's a little bit helpful. Gita, I don't know if you have anything else to add.
Yeah, I would just add that, this is the time to improve the, lines of communication. And if these are barriers that our agencies are experiencing or feeling from, working directly with food banks, this is a great time to kind of open up and usher these discussions. Food banks want to, hear these challenges so that we can kind of come up with a solution. And as Lindsay said, the money to subsidize is only one step, but I think making sure that we are clear on where the challenges are on all different levels is important. So I advocate for continuing the dialogue and improving the lines of communication.
Great. Well, thank you for those comprehensive and clear answers. Going to go to another question here that we have, and I think this probably more directed to Feeding America, but possibly to you as well, Dara. Is there potential to direct excess produce from big farmers to food banks since it's being left out to rot?
I can just start really quickly. I think I mentioned a little bit about creating those there's been a lot of obviously market disruption. And so Colorado formed a farm and food systems task force to really figure out how to better connect what's happening with producers and better meet needs in food banks and other areas. So that's how Colorado is thinking about it right now in a 2-minute answer. I'll leave it there since we don't have much time.
Yeah, and I'll just add really quickly that just the supply chain has obviously shifted on its head, I mean, completely across the board. And nationally, we are exploring every single partnership opportunity from suppliers, distributors, farmers. We have, partnerships with United Fresh, Produce Marketing Association, American Farm Bureau, et cetera, trying to lean on USDA to purchase a lot of that food. Obviously, there's just a lot of implications around distribution channels that have been disrupted because of COVID. And so we are prioritizing shelf-stable items, but know that we are in the process nationally of working with a number of different partners to ensure, food waste, as I mentioned, is a huge priority for the organization. And so we are exploring every opportunity to ensure that it doesn't go to waste. It just requires shifting in terms of being mindful of, having the refrigeration necessary to transport that. And so it just is taking time for us to build through and develop those new processes.
Great. I know we're at time here, but we had one question, well, question/comment, but I think it's an important one before we go. So hopefully everybody, I apologize for going maybe a minute or two over. We have one participant who is from Arizona, and they're hearing some similar concerns, I think, to our first questioner about from hyper-local food pantries, especially in rural and tribal communities. The emergency food system is failing in these smaller communities. So I guess I will take that and maybe frame it. Is there anything that you think that could be done to better assist communities that are very rural or are tribal communities that obviously have some different challenges in these days?
I'll just say really quickly that, as I mentioned, rural populations are a huge priority for the organization, and we have partnerships across many Native American partnership groups normally, and now is a time when we are leaning on those partnerships heavily to try and understand the need and understand how we can better support reaching those reservations and reaching populations that are in those rural communities. We are, as we have all kind of spoken to already over the course of the webinar, but realizing that we really need to innovate and change the models in which we've been used to distributing food, and there's been more of a need as ever for mobile distributions. So we are, acting quickly to ensure that we're reaching those rural populations. We have, been working around the clock with our food bank members, with our member engagement teams across the country, leaning on any partnership, both internally and externally, new or old, to try and ensure that we're reaching those populations. And so certainly doing way more mobile distributions, doing community drops, doing food delivery, leaning on partners that already have the infrastructure in which to drop off meals at homes. And so certainly trying to do our best to ensure that we are reaching those rural communities. And so those conversations are very much active, and the work is being done to ensure that we're reaching those communities that are having an increased need and issue in getting to food banks or pantries.
Right.
Yeah.
Oh, sorry, go ahead.
Oh, the only thing that I would add, I ditto to all of that. And we're making sure that for the review committees and the kind of the decision-making bodies for these funds, that the most impacted communities are a part of that process, and that those voices are fully integrated into those structures to address these significant equity issues.
That's a fantastic note to end on. So I know we've got a couple of minutes over, and I know we had at least a couple more questions we didn't get a chance to get to. I'm sure I will forward those questions on to our speakers, and we will find a way to get those out to all of our people who did ask those questions. And I'm eager to say that this is certainly not going to be the last of our conversations here at Grantmakers and Health on COVID-19 and its impact on food access and security, let alone that issue at large going forward. But I want to say thank you to our terrific panel of speakers, Lindsay, Gita, and Dara. I also want to give special thanks to everybody who stuck with us through technical difficulties, and hopefully you got a lot out of today's call. We really appreciate you taking your time to be here today. We know everybody's extra busy in these past few weeks. But if you happen to have any additional questions or comments, or if there's anything from this particular webinar that didn't get addressed, or that you would like to see addressed in future content, please feel free to contact me at any time. My contact information is up on the GIH website. But otherwise, thank you all for participating in today's webinar, and I look forward to seeing you all next time.
Thank you so much, Colin, for the opportunity.
Thank you.